Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture is the anxiety disorders that we'll cover in this lecture. So the first section basically comprises of the problematic anxiety, of course, the normal day-to-day anxiety that we experience in our life is usually quite normal and it's not pathological. And we're talking about the problematic anxiety that has its physical symptoms as well. So the features of the state of anxiety will be discussed in this section. And then we'll move on to the endocrine disorders that can result in the anxiety and anxiety-related disorders. In the second section, we'll be discussing the etiology, that is how this anxiety occurs in some individuals and why doesn't it occur in all of us. So the assessment of such anxietic patients or anxious patients will be discussed over here. That is basically hindering their normal day-to-day life. Then we'll move on to the drug intoxication. So sometimes the substance misuse can lead to these kind of anxiety disorders, and all of these substances will be discussed over here in this second section. Moving on, we'll be discussing the neurosis, which can result in GAD, that is basically the generalized anxiety disorders. And then the etiological factors and the clinical assessment when you come across a patient of anxiety in your outpatient departments and in your wards. How can you go through and assess such a patient and make out a management plan for such patient? In the third section, we'll be discussing the GAD, that is basically the abbreviation to generalized anxiety disorders, a type of anxiety disorder. So there are a lot of anxiety disorders that we can discuss. Obviously, there are multiple variants to it. And over here in this section, we'll be discussing some of the variants, the causes and clinical features of this generalized disorder will be discussed over here, and we will move on to the diagnosis. So how can we make the diagnosis on some of the clinical features? What is the ICD classification to such anxiety disorders? That will be discussed over here in this section. The management of such cases will also be discussed along with their clinical features and along with their treatment lines. In the fourth section, we'll be discussing the panic disorders primarily, and how do we go about in a typical case of panic disorder? What are the clinical features that are quite commonly observed? How can we make a confirmative diagnosis that this patient is suffering from a panic disorder? And after that, we'll be discussing the assessment and treatment lines along with this panic disorder. In the fifth section, we'll be discussing the obsessive-compulsive disorder. Obviously, we'll be discussing the etiology to it, what substances can cause such an OCD, what environmental factors can cause such an OCD, and are there any genetic factors that can conclude towards this obsessive-compulsive disorder or not. Then we'll be discussing the prevalence of this condition in the worldwide, of course, and then according to the topographical sequence of its prevalence. And then the assessment and treatment of such disorders will also be discussed along with their etiology, with their clinical features, and with their diagnostic factors as well. So I hope you want to learn more about these anxiety disorders. So do watch the other sections to this lecture as well.